to everyone in Europe. I hope everyone is doing well and great and having a good time. I would really like to welcome all of you today evening to the first Fireside Chat that CII has organized. We are organizing the CII National Nutrition Conclave, and a series of activities are being planned. We are planning a panel on innovations in nutrition and on fortification. And Fireside Chats are a series of chats that we are planning in this year and the coming year, which will be on topics relevant to nutrition nationally as well as internationally. With that, I would like to welcome both the panelists for today. I would really like to welcome Ms. Vinita Bali, who's our chairperson for the CII National Nutrition Committee. And she, along with Mr. Fokko, will be taking on the Fireside side chat today. So we welcome you, ma'am, and handing over the conversations to you.
Thank you very much, Surabhi, and a very warm welcome to everybody who is on this conversation today. But first of all, our gratitude and thanks to Fokko Wientjes, who is the Vice President of Malnutrition Programs and Partnerships at DSM. All of us who are on the National Committee of Nutrition know and respect DSM a great deal. Fokko, your organization has been in the forefront of contributions, not just to our meetings, but also in giving us a much wider perspective of what DSM is doing globally. So we appreciate your time and we look forward to a very meaningful conversation with you. Fokko also handles the large partnerships for DSM. For example, the World Food Program, UNICEF, etc. And, as we all know, the World Food Program was recognized, especially in the last year, by means of the Nobel Prize for all the work that it has tirelessly done over these years. So the way we are going to do this is, I will kickstart the conversation. We will take audience questions, and rather than a format which says we'll do the conversation and take audience questions in the end, my request is please post your questions. I will do my best as we are doing the conversation to keep one eye on the questions, and we will intersperse our conversation with audience questions. We also have a few students with us today, and at some stage we will request these students to share with us what they are doing, and in that I'm going to request Surabhi's help to call out these students. So without further ado, and another welcome to you, Fokko, let me start by asking you this very fundamental question, which I guess is on everybody's mind, and that is to do with immunity, which is very much part of nutrition, but somehow COVID has centered immunity a great deal more than it has ever been centered in the past. So would you like to share your thoughts on why and how immunity is center stage, and what an organization like DSM is doing to actually help consumers, first of all, understand the concept of immunity, and secondly, any initiatives that have been taken in that respect?
Thank you. Thank you very much. And thank you for having me here. For you, it's already late. I'm based in Geneva, so for us it's still afternoon, but for you it's already late. So great that we have so many people listening to us already while it's already evening. So thanks for everybody for chiming in here. Immunity is of course now on everybody's mind, because with COVID, we try to not get infected, but we also try to arm our body with whatever we can to make sure that it fights off any infection. So immunity is important. What we see is there's three things that are very important for immunity system, and that is stress, sleep, and food. Now, we can't do much. I can't do much about your stress. I cannot do much about your sleep. That's your choice. But I can do something, and we as DSM can do something about your food.
Well
We
said.
are what we eat. Huh? That's the statement. And I think that recognition of the importance of food has grown significantly in the last couple of years. The whole discussion about microbiome, how our body actually deals with the food. It's an extra organ. It has an influence on a lot of what we are and who we are. So I think there, the fact that nutrition zooms in now into how do we build immunity is important. Vitamin D. Interesting was that probably the best known COVID victim was President Trump. And what did his doctors do other than giving pharma to him, giving medicine? That was they gave him micronutrients. It is, if you look at what his doctors did, they gave him, amongst others, vitamin D, because it helps the strengthening the body. And actually what we are doing is we are working on a higher bioavailable vitamin D, MPD, which will launch in Australia first soon and then roll out over the globe. The micronutrients are an important part of our defense system, and that's what we need to build on in the coming period.
You made a very interesting point on micronutrients with respect to President Trump. And, your organization has been at the forefront of working with micronutrients, including a very, a new product that you launched in India called New Shakti. Now, you personally have been very involved with that. You have made trips to India, to see how that is doing. Can you tell us a little bit about what was the insight that drove that product, and how best do you believe that can be used in a country like India? We'll talk about Africa and Latin America, which is in other places where you've done a lot of work. But, specifically for India, what are some of the insights that led to the creation of this product? And what would you like to tell our audience about this product?
Yeah, maybe if I may, I would like first to take a tiny, no, maybe not a tiny, but a step back. I think why it is important that the private sector gets involved in this discussion and what the role of the private sector is in addressing malnutrition. I think that is where it starts. That's where it starts for everybody on this call. And one thing is healthy citizens make up healthy, flourishing societies. That's where, for me, it starts. And if you see that India under fives, we still have more than 30% under five child mortality rates. We still have 30% stunting rates, i.e. we have a problem. And we need to deal with that together. And it's not that the private sector can say, well, it's a government role. No. It wasn't at the university gate that all the good people went into government and all the bad people went into business. Not at all. We have a responsibility. We're part of a society. And that's why we have to take our role there. It's an opportunity. As you said, we have developed products because it's also an opportunity for business to work on this. It's an opportunity to get healthy, well-developed employment, so employees. So our employee programs are important. And in the case of DSM, of course, as we are the largest vitamin producer in the world, it's also a business opportunity for us. Now, what we did, and we have this is a sachet that will fortify a kilo of rice. So you blend it at home through your rice, and you can forget about it then and just put it in the pan, and it cooks like normal rice. And then you have nutritious rice. And I was also lucky that I got the samples. So I'm making I'm using my peri peri and my gunpowder that is fortified. So there's lots of opportunities to make fun products, good products that are serving a need. For me, it is important that we need to get products to market that are aspirational. We can't be dictating, or we cannot be intrusive on someone's choice and freedom. So we have to convince and nudge the consumer to into aspiring to good nutrition, and that is a role that we as industry also have to play or take our part in. And so let's make nutrition aspirational for the consumer. Let's make it widely available. Let's use our distribution channels, and that means for companies who are not into nutrition.
Fokko, we lost you. Fokko, we lost you.
Where did you lose? Where did you lose me?
You said so for companies. You were talking about. We lost you a little bit when you were talking about for companies it is not a choice. Working on working on nutrition.
Yeah. So where did you lose me? How long
did you lose me? The last sentence.
Oh, the last sentence. Okay.
Yes,
okay.
Yes,
so for non-food companies, make sure that you bring nutrition to your staff. That's employee programs in your meals. And for food companies, focus on making nutrition aspirational, making nutrition widely available, and make it affordable. And not cheap, make it affordable for the consumer. That is the way to forward, as far as I'm concerned.
We will spend some more time on the whole aspect of workplace nutrition, which again you have been very closely involved in. And Impact for Nutrition is a big initiative where, by the way, 110 companies have signed up. Even during COVID times when most companies are encouraging employees to work from home. We'll come to that, but you raised a very important point earlier. And I want to talk a little bit about what is the nature of partnerships that the private sector has done with either the development sector or the government in several countries. And here, I would request you to share examples, illustrations, or stories from work that you may have been involved in, whether it is Africa or Latin America. The key being that, nutrition is too vast a subject and too multidimensional for governments alone or the private sector alone or the development sector alone to address. And therefore, it requires a collaboration across multiple sectors to come together, not just in terms of nutrition specific, but also nutrition sensitive initiatives. Could you illustrate for us?
I could not agree more with you, Vinita. It is something that is, we can't do this alone. If we're talking about 30% of the children under 5 being stunted, then the problem is huge. So it's not something where somebody has the silver bullet. What we did in 2007, we started working with the World Food Program. World Food Program, the largest food aid distributor in the world. DSM, the largest vitamin producer, micronutrient producer in the world. If I tell the story, you say, yeah, it makes a lot of sense. If WFP was focusing on calories, keeping people alive, and we said, but you don't make them thrive. People will fall sick, but because of the calories that you provide, they will survive the disaster, but they will not really get out of it better. So what we did is we started to work with the World Food Program first on developing new products, so help them change their product portfolio. cost-effective solutions. We looked into better fortification of their porages. We looked into micronutrient powders. So home fortification. We give people a sachet with micronutrients and they mix it with their food at home. All that sort of solutions. Just improve and make innovative new products available. Then what we did is help the World Food Program to change their programming, because of course one is to make the products available, but second is to then also make sure that the distribution and everything gets done. And now we are at the next phase, is how can we institutionalize it? How do we really make sure it becomes part of everybody's life? And there's two main things that we're doing with the World Food Program right now. That is, one is how do we reach the beneficiaries, create the understanding for beneficiaries that they need to focus on nutrition. So nudging the beneficiaries into looking into nutrition as an essential component. And the second thing is what we think is a big breakthrough is rice fortification. And so I showed you the small sachet, but we believe, and especially in a country like India, that will be a big step forward. And the government is already looking into that, how to fortify the rice, because that's such a big staple around the world. 2-3 billion people a day consume daily rice. How can we work on that? With World Food Program, we now, because of our partnership, we reach 35 million people with improved nutrition. And that is because we brought together the two complementary competencies of these organizations. And I invite everybody to start thinking in terms of how can my competence be essential if I combine it with somebody else's, with the government of India, with state governments, or with NGOs, or with whoever, to combine strength and then get the job done.
So Fokko, I would like us to walk a little bit out of micronutrient fortification into some of the other areas where the private sector could play a significant role in ensuring that more nutritious food is accessible to more people more often at affordable prices. Because, the private sector plays a huge part in, logistics and distribution and so on. And we all know that, around the world, a very large proportion of the food that is produced is either lost in countries like India because of, poor storage and transportation conditions, or wasted in some of the more affluent countries where people buy pack sizes that are bigger than what they can consume, and a lot of food is simply thrown away. Given your experience over so many years in doing, public-private partnerships with several organizations, what are some of the examples that you could share with us where the private sector, because of what the private sector does really well, has worked with the government, either at a state level or at a central level, and ensured that either less food is wasted or lost, or that there is better access to more nutritious food, not just necessarily fortified food, but just food which is nutritious?
Mm-hmm. Yeah. No, one of the examples is that what we have is in Africa, where we have invested in a food company. What you see is, unfortunately, part of the discussion in food is in silos. So we see that there is a discussion on agriculture and a separate discussion on food. And what I always say is, if there's one thing that you remember after this conversation, is that from now on we talk about agri-food as one word and not as two words, and we consider that as one concept. That in itself will make a significant change. What you see right now is farmers, and especially smallholder farmers, who have a disadvantage in information, a disadvantage into market access. They will suffer most if they have an uncertainty at the end of the season. And what is important is that we tie agriculture and food into one system. And can you still hear me?
Yeah, we again lost you a little bit. Surbi, could you hear him or is it my system?
Ma'am, we could hear him. I think there is an internet issue at your end.
Okay, you could hear him clearly?
Yes, yes.
Okay,
Good.
my
Then we
apologies,
continue.
Fokko.
No problem. No problem. So what I was saying is, if we tie these two together, agriculture and food, into one system, you get stability for farmers because they know that they can supply into a food industry. Vinita, you've worked in the food industry your whole career, so you know everything about the food processing industry. It gives a stable demand for agriculture inputs, and that stability changes the lives of farmers because they know that at the end of the season they are able to sell. So for me, the big system change in agri-food could come by a better organized, high quality food industry. And that brings that essential stability. We've seen in Africa, we've been able to reduce aflatoxin, which is a big problem in Africa. So that's a mold that grows on for instance, maize and is toxic, so that causes cancer in the end, liver cancer. And the first season, 95% of what was offered was aflatoxin infected. And after 2 seasons, we were down to 6%.
Wow.
Because we worked with farmers, because we improved the logistics, because we brought in that stability. So food loss and food security are going up if we tie systems closer together and think more in value chains. Now, the other thing is, of course, the consumer throws away a lot of food, especially urban consumers, because urban consumers more and more look at the date on the packaging and they say, oops, this is over its date and we should no longer consume it. There we need to look into much more advanced packaging solutions. DSM has been working in the past on a solution where the packaging would turn a different color as soon as the product would be off spec and not only looking at the date. Now, those are difficult innovations. They're not easy to scale, but they are essential that we start looking more into that sort of things as well. So the consumer does not throw away products, because that's, of course, really a shame. Then we've been able to reach the home of the consumer and then the consumer doesn't consume it.
You know, Fokko, based on your experience, and given the fact that we are reading every other day that as a result of COVID, we around the world, the nutrition and hunger indicators of progress are going to be impeded because of, you know, livelihoods lost, access to food becoming difficult. You know, in India, we saw a big migration of people working, you know, moving from where they were working to the villages that they come from, and so on. And I think the FAO estimates that, you know, several million, close to 40 to 45 million people will actually get pushed behind in terms of their nutrition and hunger status. Where do you think organizations like DSM and other companies, whether it is food or non-food companies, can step in? And what are the messages that you would like to leave for those people who are on this call to say, what are the small things that we can do that will make a big difference?
Yeah. Well, it goes back to what I said before. Healthy citizens make up healthy and flourishing societies. We all have a stake in this. It's our employees, it's our customers. Whatever you produce, if it's cars, if it's electronics, if it's food, if it's beverages, it's our future consumers. So I think we all have to keep a little bit that longer term horizon in mind and make sure that we keep our societies healthy and fit, because in the end, we will not be successful in a society that would fail. So we don't want it to fail. If there's any pressure on society, it's always bad for business. So I would say, and I would invite everybody to to join and do whatever you can. The first and foremost thing is make sure that you feed your employees properly. Certainly in India, where you have the obligation to provide meals, make sure that you provide nutritious meals. Bring bring in a nutritionist and call in for help to design the meals from a nutrition perspective. And of course, it needs to be tasty. That's non-negotiable. But we can combine it. As my team has been able to fortify peri-peri, then I bet you that we will be able to find solutions for you. So that's one thing. And then the second thing is, of course, let's all advocate, both with our local governments, with our immediate stakeholders, wherever we are, whoever we are, advocate for proper nutrition. It's the best immunity builder that we have right now for COVID, and it is in our long-term benefit. We were, if you look at the Chatham House in the UK, they did a study and they say 850 billion is lost because we do not have properly nourished staff. And certainly in emerging countries and in high growth countries like India, it's a huge problem, and it's a problem where we will all suffer from if we don't deal with it.
Mm-hmm. You know, the reason when you were talking about companies being responsible for employees, as you know, Sight and Life has worked very closely in collaboration with UNICEF and others to actually create a whole initiative called Workplace Nutrition. And there they worked with chefs, actually, to design recipes which cater to the different parts of India. And, you know, there are over 30 different recipes that have been created for nutrition in the workplace because, you know, most people who go to work, especially in the factories, you end up having one main meal in the factory and one snack. And the same is true of, you know, large corporations or, you know, electronic cities and places like that, where thousands of people come into work in BPOs. And it's a 24/7 factory because literally work happens in shifts. Of course, COVID created another challenge to that with the work from home. But, you know, sooner or later, that is also going to come to an end. And workplace nutrition as a key initiative is very much part of what we at the CII Committee of Nutrition have prioritized, not just for the Nutrition Committee members, but for the 7,000 odd companies that are members of the CII itself. The thought really being that if you can influence nutrition in the workplace and, you know, create more nutritious recipes, it will, over a period of time, make a big change.
Yeah, but isn't it great that we got more than 100 signatories to this?
Oh, yes.
So we're making progress to get that impact for nutrition going. And yeah, as you said, this is maybe a challenging period, but like a company like DSM, what we did is we made sure that we made supplements, micronutrient supplements, available for our staff working from home. That doesn't leave us, that doesn't take away our responsibility for our staff. Right. So I would also challenge everybody, make sure that your employees working from home stay healthy, both mentally and physically. And also there, as an employer, it's good if your people are staying fit. It helps productivity and it helps people being loyal to you, and it creates that feeling of care and collaboration. So I would also invite organizations to start thinking about, how do I make sure that I reach people at home with proper nutrition, and yeah, make that part of the programming as well.
You know, that's another important point that you have raised, and part of the key constituents of the Impact for Nutrition program is not just about providing nutritious food in the workplace, but more importantly, providing that information, the awareness, the education that employees need as far as nutrition is concerned. And, there are certain special times in an employee's life. Let's say you're recovering from an illness or, pregnant and nursing women where there are special nutrition needs. And, those things have also been baked into the entire Impact for Nutrition program in terms of at least that being communicated, even if people are not physically coming into work. I want to just take a pause here and remind people in the audience that if you have any questions, you can start posting them in the chat box. We had said we'd take the last few minutes for the questions, but if you start posting them, then I'll take a look at the questions and intersperse your questions with, in our conversation itself. So, Fokko,
may I make here before you come with the next question? I would like to congratulate CII, the members, with these type of activities. Impact for Nutrition is now on the agenda. Let's accelerate it and let's grow it. I think we still we have now more than 100 pledges. There is still 5,900 to go, I would say, and I would invite everybody in CII to think about this. And even if you're completely selfish, healthy employees are good for your business. So from that perspective, and I would also congratulate things like if you look at Tata Power, that is taking that sort of initiatives. If you look at Arvind Mills, there's many very positive examples, and let's do a lot of peer-to-peer learning. Why does Tata Power do it? And what can we learn from that? And how can we make sure that that type of initiatives, that type of forward thinking, and I'm sorry for all those that I do not mention because there's many more of these positive examples. Let's learn from these positive examples. Let's grow it. Let's roll it out. Let's do it.
No. Absolutely. I think you put it. I think you put it extremely well. I think it is the responsibility not just of the company but also the individuals to take full advantage of the extra education and awareness that companies are investing in. And I do believe in its own way, COVID has played a very important role. In fact, Fokko, it has highlighted immunity better than anything else could have highlighted immunity. Because suddenly, whilst nutrition was a difficult concept to grasp, immunity somehow is an easier concept to grasp, which is that if I improve my immunity, then COVID will have a harder time infecting me. Putting it a little bit in a light-hearted sort of way. We moved away from fortification, but I want to come back to what you talked about, rice fortification, and there has been. There is an intent as far as the government is concerned to actually move to fortified rice in the rice that is distributed through the public distribution system. So what are some of your key learnings based upon similar work that you may have done in other countries? What are the things to watch out for? What are the things to do more of? What are the things not to consider?
One of the things is what is extremely important is get the right standards. And there's always a lot of discussion about standards, both in sort of how much nutrient, what nutrients, etc. And we have to be careful at the start of this that it's not a cost game only. Otherwise, we would do ourselves an enormous disfavor by coming out with a product that is not, in the end, proving its impact, its nutrition impact. So it's important that we start off on the right foot, a product that is both nutritiously the best what we can do. And the second thing is it also has to be from a shape, from a from a concept perspective, it needs to be the best. So I've seen rice samples where you say, yeah, but it doesn't look like a rice kernel. We shouldn't do that, because then we're actually shooting ourselves long term in the foot. We need to come up with a product that looks like rice, tastes like rice, and blends in rice. So the concept is, for those that have not heard of this before, you take broken rice, you run it through an extruder, you recreate the rice kernel, and then you blend it 1 to 100 through rice. And if it looks like a rice kernel, then it disappears. So it is consumers don't even realize that they're eating it, and we don't have to explain to our children that they're getting something healthy, which of course children will start to pick out if they don't. They're picky, and they don't know, because this is just rice. So that's I think one of the things that we need to keep an eye on. What we've seen in the United States, they've even been doing fortified rice already for a long time. In Latin America, fortified rice is already longer on the market. It works really well because it is such an invisible fortificant that it disappears in the staple, and that's it. And so I think it's a very promising staple that we need to start looking into.
Mm-hmm. So Fokko, I'm going to turn to a question from one of the people in the audience. Let me, one second. Oh, we have many questions.
We have 2 questions, ma'am.
Yeah, I'm getting to it. So the first question is, with the UN Food Systems Summit next year and the dialogue on using a systems approach, can you share examples of where you have seen this being done?
You see it in a variety of countries. You saw that, for instance, in the Netherlands. I'm Dutch, so I can talk quite closely from that. A couple of years ago, recognized to move away from focus on agriculture productivity. The Netherlands has very high productivity, into a system that delivers a positive environmental impact, a positive nutrition outcome, and a positive social impact. So from an employability perspective, etc. So 5 years ago, the country strategically, policy-wise, changed from a focus on productivity towards output of the system. And that is a very important change. And of course, not every country can make that same shift at the same time, but it starts to be important to start thinking in bigger terms. And that's also why I gave the example of what we do in Rwanda, where we put a food production entity, which was not existing there, a high quality food producer, as a way of creating jobs, as a way of creating stability in a system, and in a way of creating an output of the system in nutritious, safe food, while creating jobs and a climate resilient approach. So every country will have its own specific challenges where the system needs to change to. And in our example in Rwanda, it was jobs, it was nutrition, it was safe. That's what we try to do in this case.
Mm-hmm. You alluded earlier to ensuring that there is the nutrients that we are adding, let's say, to the rice. The quantity of nutrients is significant enough for it to make a difference. Now, as you're aware, a lot of work has been done in India with the regulator, the Food Safety and Standards Authority of India, to create the fortification standards for these staples. In your experience and in your opinion, what is the best yardstick to use when it comes to fortification? Because there are 2 things. One is, products that are available commercially in the market. versus products that are actually designed to get to vulnerable populations. For example, in India, we've got the midday meal, which feeds children in school who otherwise do not get 2 hot meals at home from their parents. So what is some of the advice, for want of a better word, that you would like to share with us, which is that as we are designing more and more of these programs, what are the things to look for? What are the things to avoid? And what are the mandatories in a program like this for it to succeed?
Yeah, I think there's a couple of answers. One is, of course, if you look at that take-home food ration program that India now has started, that's an interesting hybrid because there you bring the industry and the beneficiaries closer together. So I think that could be a very interesting, a bit more innovative approach. It's a bit different from the pure safety nets. One of the most important things for me is whatever we do, whether people are poor or rich, it has to be aspirational. So even for the poorest of the poor, let's not give them products that are in any way substandard. We shouldn't do that. That's one of the most important things that everybody has an expectation when you get rice, how it should look like. And if you then blend through there an fortified rice kernel that doesn't look the same, then you're just doing nobody a favor. So I think that's one thing. The second thing is, I think, also looking into how do we give people the dignity of choice. And that's why I'm saying the take-home ration might be an interesting, I don't know all the details about the program. What I've heard so far is that might give us a bit more the feeling of choice, a bit more the idea of connecting local parties, the local producers with the local consumers, which I think is an important element in there. So, but let's not ever forget that food has to be aspirational. Nutrition has to be aspirational. That's what we have to do first. From a nutrition perspective, we always have the feeling to say we need to design the best standard, but that's not enough. It's the best standard in a food that is aspirational. That's why the recipes, that's a brilliant way, because that means you do something what people want, what people like, what we like to taste the right food.
Absolutely.
And that's the name of the game.
Yeah. So here's another question from the audience. Food companies sometimes paradoxically face a bias of lack of trust when they engage. How do we address this? As food companies have a lot that they can bring to the table. I completely agree, with this sentiment. But somehow there is this lack of trust, which is that if you are, an organized player, then you must have a hidden agenda. So what can food companies do? And it's a real problem, because unless there is trust, we can't bring the best to the table, because there is always this feeling of what is the hidden agenda behind the overt agenda.
Yeah, I think it's a very, very good question. So thank you for bringing it up. And it is a very challenging issue. The food industry has a trust deficit, strangely enough, you would almost think, because the food industry has brought safe food, has brought nutritious food and made that widely available. Now, I think there's a couple of things that we need to do. One is, of course, we do need to start looking into reformulation to a certain extent. So can we do with less sugar? Yes, we can. And we still get the same mouthfeel, and we can still achieve the same taste. So let's seriously look into reformulation wherever we can, and that's a critical item for everybody to start doing. The second thing is that goes back to our earlier conversation around public-private partnerships. We have built up a certain trust in DSM because we show the sincerity to work with others, to work with UNICEF, to work with the World Food Program. And that's why we are seen as a trusted partner. So I think that's also a message that I would like to convey, is work seriously and from a sincerity with other partners that can help create and confirm the trust in what we're doing. It's not only about profits. Of course, in the end, the food industry has to make a profit. That's everybody understands that. And that's not a secret that we have, but it doesn't mean what I said before at the university gate, that all the good people went into government and all the bad people went into business. Not at all. We have a responsibility, and we also have an opportunity. If you now look at some of the markets where the high growth is in healthy snacks, the high growth is in more nutritious products. The high growth is in different products than what the consumer was aspiring to yesterday. Now, whether that is already the case in India or whether it will be the case in India tomorrow, but that trend is there. That train has left the station. So everybody in the food industry pay very close attention to the fact that the consumer will over time will shift to a more nutritious, more healthy food choice. And you see the big companies investing in that. The big companies are investing in all these health trends.
Mm-hmm.
And I see actually that I think there is also upcoming a chat around healthy snacking, for instance.
Yes,
so
in fact,
I highly recommend everybody to watch that and participate there.
In fact, one of the sessions that we are doing as part of the Nutrition Conclave is innovation in in food, and how are some of the companies thinking in terms of bringing in innovative ideas into the food propositions. Not just from a taste perspective, but also a health perspective.
What for me is important, there's three things that we need to do in the food industry. One is we need to look at choice influencing. How can we get the consumer, how do we nudge the consumer into healthier choices? So that's, I think, one. And that's a collaboration where we need to work also with other partners, with public sector partners, with the government. How can we influence the choice? How do we create the awareness? I think the awareness should be a prime concern for everybody. The second thing is for the governments, at one point in time, you need to start guiding. You need to create guardrails. You need to start editing. You need to say, this is what we no longer allow, and gradually move together into a change of product portfolio. And the third thing, what you already just mentioned, is innovation. We as companies have that power to innovate and to come up with new solutions, to reformulate, to bring the consumer very aspirational new choices.
One of the very interesting points, Fokko, that you had made when we were doing our, preparatory call was really to say that if you look at the food industry, and if I look at the farmers, each of the farmers are entrepreneurs because, each farmer is growing what they grow and bring it to market. The other reality of the market in India is that if you take the total market for food and break it down into what is branded and packaged, it's actually a very minuscule part of the total food that is consumed. India is also an interesting country, like several other countries like Thailand, where a lot of food is consumed standing on the road, which you would have seen. People are going to work, coming back from work, and the breakfast is on the road, or a snack in the evening is on the road, and so on. Is there a message that we have for that kind of food? So it's not just I walk into a supermarket and I buy processed branded food. It is raising that awareness within people to say that there are certain foods that are more healthy than certain other foods. And therefore, what becomes the responsibility of, governments, including, private sector players. I could communicate and tell you, eat my products because, they are the best formulated. Or I could actually spend my communication budget educating you about the value of nutritious food, which may have nothing to do with the food that I sell. So, have you come across organizations like that who are saying that we believe in selling the concept of nutritious food? We believe in selling the concept of how to identify nutritious food, and it is not just necessarily, the products that we make. Or is that too much to expect from industry?
Well, it's a very interesting question. That goes back to what I said is the awareness at consumer level. So we need to help the consumer to make better choices. What the World Business Council for Sustainable Development did a couple of years ago, they pulled together a large group of, and those were big companies, a large group of big companies. So there were 30, 40 big companies who then said, we all have a problem because we want to make a shift, but the consumer is not yet recognizing that shift. So we need to start thinking in fork back to farm. How do we now transform that whole system? But how do we make sure that we get that the consumer to be part of this? Otherwise, we push a solution while we need to make sure that we pull. Every marketeer in this call will recognize that it's the creation of the pull that will make the difference.
Exactly.
And a product pull is better than a product push. And so it's a very interesting and challenging environment, the environment of India, because it's so unpackaged. So I not necessarily would say I have a prime example where companies came together to completely promote it. Well, in Ghana, together with a couple of companies, we have been working on a food logo together. I also remember in Europe, there were a couple of companies who worked on a food logo together to try to get, to help the consumer in the choice. But I have to admit, it is mainly towards packaged food. Unpackaged food is much harder. Then you get into what Jamie Oliver did in the UK and what the chefs in India did together is to get into recipes, into educating the cook in all of us. I'm using my peri-peri and my gunpowder here in my kitchen. And that's part then of the education. And maybe from a CII perspective, it would be very interesting to say, let's do more down that path. I would certainly support that.
Right. So this is a very specific question from somebody in the audience, where they ask, what is the one message you have for nutritious diets, for inculcating nutritious diets for people working from home?
Sorry, can you repeat?
So it's basically for people who are working from home. What is the one message that you have to incorporate nutrition in our diets?
It's extremely important. I mean, I've been working from home. I was every month once or twice in India, and I stopped traveling in February. So I've been working from home. And of course, it is what I said before. It's the three things. It's food, it's sleep, and it's your stress management. And if you look at your food, what you have to be careful is because we're constantly in these calls and constantly we're stable, we're in one position behind our desk. So working from home really means that you have to control your calories on the one side, so you don't have too much hardly noticed snacking at the side, and on the other side, make sure that you have the variety in your food, and concentrate on that. Don't eat the same thing. But on the other end, what I personally do is, certainly in this period, is make sure that I get enough vitamin D and omegas. So I actually supplement my food, although I have a healthy diet, but I still supplement it. In Europe, it's now winter, and supplementation of food is, I think, in our case, is also keeping us much fitter than without.
Okay, we have the last 5 minutes. I want to make sure we respect everybody's time, but we've got a very interesting question, again from the audience, which is, how can global partnerships and digitization improve malnutrition in developing countries? Or, in other words, what is the role of global partnerships and digital technology to address malnutrition?
Yeah. I think we're still very early in that whole stage. If we look at the whole tracking that would be improved, we can much better track where the food sources that will help in food security and in food safety. We can also much better track what happens with the product, what is added to the product, or what is taken out of the product. So that would help in nutrition. So I think, and of course it will connect. I spoke before about agri-food being one system. If we are able to connect it also better digitally, that will also certainly will contribute. But I think we haven't seen yet what will all be possible. So I'm inviting everybody to share practices, and that would maybe a great fireside chat with
a follow-up fireside chat.
I will be watching, because that will be very
it would be
educational for all of us. So let's maybe make that an issue.
We will. Let's do a follow-up on that. So Fokko, I think we'll make this the last question, which is, again from the audience. Would you like to share specific enablers in specific regions across the globe that have contributed to improving nutrition in COVID times?
Oh, that's a very broad question, and we could probably talk for a long time. Very different. You see, certain countries made certain things mandatory. Finland went to mandatory vitamin D fortification. Just made it mandatory.
Oh, is that right? So what did they do? They said
they made mandatory fortification standards for a couple of products. So that's one. And Finland, you would say people are educated enough, have enough income to make a choice. Still, Finnish government said, we make things mandatory. That's it. Sweden following. So that's one.
So what did they do? They just mandated the supplementation of vitamin D, or they made it mandatory to fortify foods with vitamin D. What did they do?
Yeah, they made it mandatory to fortify foods with vitamin D. Yeah. So they increased that. So they looked at the products that people consume on average, and they made fat fortification standards. So that's one example. Of course, you see a lot of stimulation. The UK is now looking into standards for also there on vitamin D to hand that out to through their NHS program, certainly to vulnerable populations. So they're looking also at countrywide implementations. Those are a couple of examples that I know of. In general, to be really honest, I'm disappointed to see that governments are looking now mainly for the headlines in how can we get the vaccine.
Exactly.
And that has been front news. And I think we as food community did a poor job so far in getting ourselves on the front page. In Switzerland, where I presently live, the government also there is looking into what can we do to stimulate. It's not front page. It's at best page 3 and perhaps page 5.
I think that's a very significant point you have made. Somehow, if the headlines have been grabbed by a vaccine. And, you know, the more systemic and the more enduring and the more causal things, which really have to do with a healthy diet and a nutritious diet, seem to have forgotten. And I think we'll probably end up paying the price for this in some form or manner, because, you know, immunity is not just immunity against COVID, it is immunity against any infection.
Yeah. Yeah, and a healthy development of our
Exactly.
children, and a healthy development of ourselves, and a healthy maintenance of our own body. Absolutely, I could not agree more. And I think we have not yet done what we should and what we could do to make sure that it grabs a little bit more the headlines. But yeah, you see that very often is the medical side gets more attention. I'm helpful though. I would like to leave on a message of hope,
Yes,
where you
yes.
see that what I said before, what you are what you eat. I think that notion is increasingly recognized, and let's push that together. Let's do make an issue that everybody starts communicating more, that food is such an important part of us. It feeds our engine, both with the calories, but also with the micronutrients that are in there.
You know, wasn't it somebody who said that your best medicine is food? And, you know, if you eat the right food, you know, then the need for medicine actually drops off. So what we call healthcare is actually sick care. But if you take care of yourself with food, then you will not need that healthcare. So
absolutely. And India has a beautiful tradition in focusing on food and adding the elements when your children have to do an exam, and having turmeric as an anti-inflammatory. So I think India is the perfect opportunity to put more emphasis on nutrition in food, and so in that respect, I'm optimistic. We have to
actually,
stay optimistic.
that's a great point, because, you know, when you look at the addition of certain ingredients in everyday cooking, you know, which have suddenly become very, you know, very top of mind, whether it is, you know, curcumin, which all Indian curries use haldi, which is basically curcumin. You know, there is cinnamon, there is nutmeg, there are cloves, there are all kinds of spices which are used, you know, as part of cooking our food, which are actually meant to, you know, take care of exactly the issues that we've been talking. But we've created enough material, Fokko, for several fireside chats. So, you know, so I would like to be respectful of your time and everybody else's time. I think we had great participation. We've had over 100 people listening to this at, you know, this hour of the night for us and evening for you. So on behalf of all of us, and especially CII, I want to extend our gratitude and thanks for sharing so generously openly with us, and for making your time available. Thank you.
It was my pleasure.
All right. Thank you.
Thank you.
Thank
Bye-bye.
you. Bye-bye.
All right. So we just leave?
Yes, ma'am. Thank you so
Okay.
much.
Thank you.